Jazakallah khair. Jazakallah khair. Thank you very much for having me. I'm Saad Hossain, and today I hope to share a little bit about my research on the use of augmented reality to guide lung ultrasound acquisition. This work.
Oh, can I see? It might be on the Zoom. Sorry. There we go.
Oh, so I just go. All right, so a little bit about me. So I recently graduated from the biomedical engineering program here at Waterloo with a specialization in medical AI. I've worked at a number of AI, I guess, based companies, and they did all sorts of things. They built AI models for activity recognition, worked on tooling for AI evaluation, and currently I work at a company called DeepRead, which develops AI for medical imaging, more specifically lung ultrasound. Inshallah, today I hope to share a little bit about the problem space and the problems that we work on. Outside of that, I've also been involved in a lot of other research as it pertains to AI safety, whether that's in large language models or computer vision, a lot of applied AI projects like uh, defect detection, pose estimation, and yeah, just I guess, alhamdulillah, things all over the place. But today, main problem that we're going to focus on is that revolving around lung diseases. So lung diseases actually are the second leading cause of hospitalizations in Canada. So they're a very large problem and they're a very significant problem. Not only that, there's a lot of manifestations of this. So there's a lot of different types of lung pathology. Specifically, the ones that I guess the examples that I've shared are pleural effusion and pneumothorax. So pleural effusion is basically when you have fluid in your lungs. So let's say there's some type of internal bleeding, your blood can collect. If you have pneumonia, also fluid collects. And essentially, if you have too much fluid in the lung, you need to take that fluid out, and it generally requires very intense medical interventions. And there's also pneumothorax. If God forbid somebody is in a car accident or some really like somebody gets their lung punctured due to a gunshot wound or something like that, generally what would happen is their lung would collapse. And obviously they would need to make sure the person's supported so that they can breathe appropriately. And so these are a couple of essentially problems or examples of lung pathology. And generally, how people detect or how people know whether there are these problems is by using chest X-ray. So just out of curiosity, I'm wondering if like how many of you people in this room have either had an X-ray taken or seen an X-ray machine, just out of curiosity. So I'm pretty sure a lot of you might know that they're very big machines. They're very massive. They're not portable at all. They're ionizing. In fact, the fact that they're ionizing and that they're irradiating actually contributes to a non-negligible number of cancer cases here in Canada. But also, yeah, they're very expensive. And if you imagine somebody gets into a car accident, you have to wait till they come to the hospital, and they have to, wait, or usually, they have to go to the X-ray chamber, and then there's a very long process. However, for very acute conditions or emergencies, there's the emergence of a new technology or a new device called ultrasound. Like a lot of us might be familiar for it in terms of its use in gynecology, in terms of seeing a baby, but you can also use it for lungs, and it actually solves a lot of these problems. So it's actually very portable. In fact, you could carry it in your pocket. In fact, I have one with me right now. So imagine all the things that a chest X-ray can do, but right in your pocket, right? And all you need to do is, you just scan someone's lung, and based on the imaging, you can kind of see what goes on and whether there's fluid. And yeah, so it's a safer, more portable, and more cost-effective alternative. And it's even more performant. It performs a lot better as well. So that's all great, but how come everybody's not using it? Why is chest X-ray still the main thing that people use? And the reason for that is if you look at these images, probably, or at least when I first saw these images, I had no idea what was going on, and I still struggle to understand what's going on. But they're very complicated to interpret, and they're very minute details. Imagine somebody's lung is collapsed. A very small there's very minute details that would indicate that or that would show signs of that pathology, whereas on a chest X-ray, it's a lot more obvious. So this actually requires a lot of specialist training, and if anybody's familiar with how medical curriculums are, it takes forever for them to actually integrate anything new. So companies like the company I work at, DeepRead, actually work on building AI models to automate this diagnosis so that this expertise that very few people have, that very few physicians have, can be democratized, and then a lot of people can use it. And it doesn't need to be something only, a critical care fellow or a very specialized doctor can use. Literally anybody, or hopefully a large array of people could use it. And that knowledge is essentially democratized. But that also means that you need to know how to take an ultrasound scan. It means you need to know how to operate this probe. You need to know where on the body to put it. And you need some type of GPS for an ultrasound machine because that itself is not the most trivial thing to do. And that is the problem that my project or my research here looked to solve. So it was to design something that non-sonographers could use, that something that guides them to correct probe placement so they know where on the body to place their probe and to do it correctly during, particularly for lung ultrasound scans. So the objectives were, or for the system, were to identify lung zones, so basically where on the body to put it, guide the probe placement, and then collect the images. So generally, how they do that is through what's called the Blue protocol. So there's four points on the body, or four lung zones, as we call them. And yeah, so they're as we see on the diagram, and they have very interesting medical names. But yeah, so essentially, if you take scans of these 8 landmarks, you should get a comprehensive idea of what's going on in the lung. But even understanding, once you've placed your probe there, understanding exactly how to handle it in terms of whether you move the probe too much, whether your hand's a bit shaky, whether you're applying the correct amount of pressure, or whether you're even at the right spot. Remembering the sequence and all that can sometimes be a bit complicated, and it's kind of the problem we look to solve. Some of the impacts of a system that would guide it, it had impacts that are social in nature, that are environmental, like it would reduce a lot of resource usage. It's a lot more energy efficient, and it's just straight up a lot cheaper. So those are some of the impacts we look to have by introducing this technology. Now, in terms of how we designed it, we first set out a couple of objectives. As we mentioned earlier, the system should autonomously be able to identify the locations of the lung zones. So if you take a picture of the person, it should be able to know exactly where on the body all those points that I showed earlier are. It should then be able to, make sure that the person is correctly handling the probe. It should communicate this information to the user, and it should improve the quality of the scans they actually acquire. And it should also just be easy and comfortable to use. So this was essentially, we opted to use a smartphone-based AR application just because the headsets are incredibly expensive, and there aren't too many hospitals that would, yeah, be willing to spend that amount of money on these devices, whereas smartphones, everybody has them. So this is a demonstration of how our system works. So you have your phone, and it's a smartphone app. And you essentially gear it towards towards the patient. You position it correctly, and the app will instruct you how to position it. And then the app will also tell you where on the body to place the probe. And then once you've placed the probe at the right spot, it will tell you if you're putting too much pressure or too little pressure. It will tell you if you're shaking the probe too much. And then it'll tell you when you should be able to take a scan correctly and appropriately. So just a better look at the UI. So as I mentioned, it instructs you how to position the camera and then where to place the probe and how to correctly take a scan. So a little bit about technology, I'll kind of brush over this a bit, but it is using AI technology or using computer vision, or in more specifically, it's using pose estimation. So essentially detecting landmarks on the body. And based on that, based on certain landmarks, you can then infer where the lung zones are. We also used some hardware, so we used, a number of sensors. We had a very talented hardware engineer on the project, was able to make a probe attachment that just attaches to this probe, to the probe I showed you, and you can then sense if somebody's applying too much pressure, too little pressure, and all that lovely stuff. There's also, erroneous movement detection, so we implemented some fancy engineering math, and yeah. And then just a diagram going over how the data moves. So we had the attachment to the probe that does all the data processing, and then on the smartphone we did most of the thresholding and obviously communicating exactly the necessary information to the user. Now, how exactly did we evaluate this system? How did we know how do we know that this works? And we essentially did a study at Fanshawe University, which has a respiratory therapy program, and they're like specialized nurses who basically focus on respiratory therapy problems. And we had three groups of them. We had a group that had no training in lung ultrasound at all, so they basically never essentially used an ultrasound before. And then there were two groups that were given a 30-minute presentation. One of them was given our application, and the other was just given a paper guide. So you have a paper guide over here, which is basically displaying a lot of the information that our app has, but in a paper medium. And then obviously you have someone using our smartphone itself. So after we ran the study, we had a lot of nice user feedback. They mentioned it was easy to use and, no training was needed. It really reduced a lot of burdens for them. And it was something that was well accepted. And that's kind of one of the things we wanted to measure from the study. Can such a system be user-friendly? Can it be easy to use? And can it essentially help people do the very task that we're looking for? And yeah, as we know, thankfully we found it to be a useful and usable system. We also noticed that it decreased physical load, decreased the number of effort needed, it decreases mental load. It did increase frustration, possibly because it tells you when it's wrong. So if you know when you're wrong and you have to keep on correcting yourself, oftentimes we hypothesize that might be a reason why it's a bit more frustrating. We also noticed that scan qualities were quite similar for, I guess, between all three groups. Even with training with our device, we noticed a lot of similarity there. We were hoping to do better, but we found that it was still, they're quite even, if not ours is very marginally worse. Did we achieve the goals we were looking to achieve? So we still could not improve our scan quality. We could not, like the scans that people took with AR guidance were not always significantly better. And we believe that further iterations of this application, if we could essentially iron down some of its, like improve the algorithmic performance and essentially improve a lot of things related to it, we believe that this could improve. But for a first iteration, we thought the results were pretty promising. And yeah, I guess that kind of summarizes. I just wanted to give some acknowledgements because I did work with a group of engineers on this project and had a lot of help from Deep Breathe and Fanshawe College and yeah, a lot of parties. So just wanted to acknowledge their contributions and yeah, thank you.
Thank you so much, Saad, for that great presentation. Any questions?
Mhm.
Right there.
You mentioned that there's room for further improvements. Do you think that these are hardware limited at the time, or do you think that with a smartphone you can still achieve this given more time to work?
So there's a couple of things. So right now, our application actually did not completely or like fully integrate with ultrasound software. So normally, one of these devices, you could just connect it to your phone, right? And you'd have a smartphone app connected to it. So our app was actually one that's separated from that. So it wasn't integrated with that app. So basically, we had an iPad or a tablet that would stream the ultrasound feed, and we had our application. We believe an improvement, like just integrating those two apps so that it would just be one thing to see and do better user flow. That's one improvement. We could also use AR headsets, especially with them being more cheaper or continually decreasing in price and improving in fidelity. We believe that having it head mounted means they would no longer need to hold a phone. They kind of just see everything overlaid in front of them. So those are some of the improvements we envision, especially as people develop more on AR. I believe that this is a technology that has a lot of potential. Yeah. Thank you very much for your question. Yeah. Yeah.
So I was wondering, I might have missed it, but do you have a specific age group or like age range, or is this like for everyone?
So we intended any adult to be able to use this. In our study, it was primarily first-year respiratory therapy students. So I imagine their age range is probably anywhere from 18 to 25 would be my estimate.
Like who they're using it on.
Oh, who they're using it? Oh, it could, well, anyone you could use ultrasound on it would be applicable for them. In terms of the AI algorithms, because we used existing 2D pose estimation methods that are generally applicable to a large subset of the population, we don't foresee limitations there. Obviously, we didn't test. We only tested on one male patient in our study, so we didn't exhaustively test it. So I can't give too much certainty there, but theoretically, it should be extendable. Yeah.
So you showed the AI model at landmarks of the user. So you showed 4 landmarks. So did you use 4 or you use more than landmarks to let the users move their hands?
So in terms of, we used the 4 landmarks shown. So these 4 landmarks, we kind of use them. So these are what very well-trained AI models can already infer. And essentially the 8 points, or lung zones as we call them, are basically inferred based off of those. So yeah, we infer all 8 points, but we use these 4, which is the shoulders and the hips, to infer those.
Did you have an issue? So those landmarks, those AI models, they trained on specific distance away from the user. So was it like they had to get the phone at a certain height, or how did you up that?
So we actually instruct them how to orient the camera and how to position it so that we can kind of restrict their view to a view that works well for our algorithm. So that's how we kind of restricted it, that to make sure that they hold it at a certain distance that correctly essentially has a good view on the user at a correct angle. Yeah, hope that answered your question.
You guys have for one more.
So my question is more about the interpretation of results. So you said you would use an AI model so that the users can just deduce the result by themselves. So I'm just asking, like, do you need usually expert help in this situation? Or if not, then what can you do about the false negative issue that occurs the most in medical AI? For example, the AI says it's negative, but it's actually not.
So generally how these essentially the way these are developed is so that they have high sensitivity, or the AI algorithms themselves. So false negatives are not too much of an issue. So the models are adjusted, or the metrics are adjusted, and it's calibrated such that sensitivity would be like 1 and specificity would be as good as you can get it. So maybe like 0.7, 0.8. Generally, the algorithms so far have proven to be quite performant on both sensitivity and specificity. So the main thing is you don't want any false negatives. False positives, while not ideal, are still, there's not as much risk, they go on for further scans. So we kind of, adjusted or tweaked the models. Do we need expert help? So right now, for FDA approval, at least, they're marketed as assistive devices so that doctors would use them. But if they could reach a certain level of fidelity, we hope that it should allow people to make more autonomous decisions, and so that an expert would not be needed. That's the ultimate objective of this line of work, so that we could kind of get the expert out of the way. Or not out of the way, but yeah. Yeah, not out of the way, but like so that more people could use it. Yeah. And yeah.
Okay. I think that's all the time we have for today. If anybody has any more questions. Yeah. After. Thank you so much, Saad.
Thank you very much for having me.
Okay.